I'm here to expose 5 unethical practices or manipulative tactics which is followed by the patient walks in with the chest pain and ends up doing an angioplasty, which is silently draining the patients emotionally and financially without giving them a real choice to make. For example, patient walks in with a chest pain and advice for angiogram, which is approximately 15,000 to 20,000, but the patient ends up doing an angioplasty, which is costing around 1.5 lakhs to 2.5 lakhs, often with emergency concern, without second opinion, or without symptoms that demand an urgent intervention. So watch this video completely, so you should be aware of these 5 unethical tactics where you should not be pushed during an emergency. Blocks are 90%, blocks are 95%, it's very urgent. So this is a very common scenario which we hear after doing an angiogram, showing the images in the computer and scaring the patients by exaggerating the blocks severity. You need to understand, with every blocks there will be a collaterals which will be formed, and there will be a blood circulation which will be happening through the collaterals, which will be close to 30 to 40% of blood circulation which is already happening. So you need to understand, 90% block doesn't mean only 10% of the blood is going. So no pain, no symptoms, yet you are pushed into an emergency mode. You may get a heart attack anytime. This is the second tactic. So actually they're not recommending the required treatment, but they are selling your fear. Most of the stable blocks with medicines and lifestyle, we can manage the condition and angioplasty may not be required. This is the second tactic. So the third tactic is, we have already kept the stents ready. You have got 2 blocks and 2 stents to be placed immediately. The procedure is psychologically prepared before the patient even knows the results. So you need to understand, this is psychologically preparing yourself to go for the procedure. This is the third important tactic. If you delay, it becomes a high risk. This is the fourth tactic. This is to avoid the patient go out of the hospital, or to go for a second opinion, or fear of losing the patient. So they create this false sense of urgency so that they don't want to lose the patient. This generally happens with senior citizens with children settled in abroad, where the husband or the wife who is standing outside the operation theatre cannot take a immediate decision, ultimately end up doing the angioplasty. The fifth most shocking manipulation, family signature taken inside the cath lab. So your husband will be taken for an angiogram inside the cath lab, and suddenly a nurse will come out and immediately she will be asking for a consent to proceed with an angioplasty. This is purely to give an emotional pressure. Patient is sedated and anxious, and the consent is rushed, and the angioplasty is ultimately performed. So don't get into this trap. Share this video with all your friends and family members.